all of the years of my research, I've never heard anybody say, well, I want to go and live in long-term care, and people want to stay home. They want to be home for as long as possible. So I feel like, looking for ways to make that possible, to empower seniors to be able to have a community of care around them that allows them to stay where they want to be, which is at home.
Welcome to this next episode of the Kernel Pod. I'm very happy to have as our guest today, Lisa Meschino. Lisa is a research associate and curriculum lead at OpenLab at the University Health Network. And Lisa and I know each other through working on some research projects together. We got connected a while back through the University of Waterloo Research Office, and we started collaborating and connecting and had lots of great conversations. I'm really happy that we're able to work together on an Insight grant funded project with the Social Sciences and Humanities Research Council of Canada. So it's really great, Lisa, that you're willing to make time and just share some of your thoughts and insights today. And so I'd like to maybe give you a chance to introduce yourself a bit. The first question that I wanted to ask you is just tell us about some of the different things that you're doing in supporting seniors, things that you have done in the past, things that you're currently doing, working with persons with dementia and just working with seniors during your career. If you could give us some highlights and some idea of what you do, that would be great.
Absolutely. Thank you so much, Andrew. It's really great to be here, and I really welcome the opportunity to talk about the topic of working with seniors, because it's something that I feel really passionately about for pretty well all my life. But in terms of the different roles that I've had and the ways that I've been involved in working with seniors, I would say mainly they fall into three roles, really, three basic roles. So I've worked with seniors as a researcher. I've worked in community with seniors and for seniors as an educator, and I've also worked with seniors as an artist. So in terms of as an educator, I've spent a couple of years with the Alzheimer's Society, working actually up in Northern Ontario in Blind River to raise awareness about dementia and to provide education for family members, for businesses and community members, community services around dementia and how to support people with dementia. As an artist, I was fortunate enough to work at UHN. This would have been maybe 8 years ago in a pilot project that they had called the Dotsa Bitov Wellness Academy, which was a very unique environment of learning and recreation for individuals in the community who are living with dementia. And basically the center ran art programs, so music and visual art and storytelling and dance, where we engaged with seniors with dementia, with their family members, with their caregivers in this very unique space, all for the purpose of building relationships with and understanding and learning and creating community with people with dementia, sort of breaking down some of that fear and some of that stigma around dementia. So that was a really incredible experience. And then as a researcher, I worked on multiple projects when I was at University of Waterloo, actually with the Murray Alzheimer Research and Education Program. It's been a while since I've talked about that. We worked on multiple projects, both with seniors in the community and seniors in long-term care and retirement homes, to understand purposeful activity and leisure and recreation. And through that work, I was able to build a program with the local chapter of the Alzheimer's Society called Gather at the Gallery, where we again worked with galleries and local artists to run arts programs for seniors with dementia as a way of, again, integrating them back into the community and building those relationships with the greater community, but also with family and friends and care partners. So giving them an opportunity and environment to learn something new, do something fun, and feel like part of the community again. And currently, my role, I would say, is as researcher and curriculum lead. So I'm taking what we learned at the Dotso Bito Wellness Academy, that environment where we ran arts programs and we were building relationships, taking that learning and embedding it in a current project, a new project with OpenLab, where we are working with seniors in high-rise buildings in Toronto. So these are not retirement homes, they're not long-term care homes, but they are buildings that have a high concentration of seniors, people who've downsized or who want to move more to an urban center, to work with them to, again, build a senior-run, senior-led, resident-run sense of community, a community of care, so that those residents feel supported, feel that they have a good quality of life, and can live and thrive and remain at home for longer rather than, have to go into long-term care or retirement homes. So doing a lot of evaluation and program development.
No, that sounds so interesting that you're able to bring together all these different aspects of research and art, education, community building on the ground, sort of working directly with people. And it sounds really amazing to me that you're able to bring all of those different angles together to support what you're doing. I'm wondering if you could tell us what motivated you to go into this line of work. And I guess when I say line of work, there's multiple lines of work, but sort of all around supporting seniors in various different ways. Are there some particular factors that moved you in that direction, or experiences that you had that helped you decide this is what you wanted to do?
Yeah, I would say I think a lot of it is sort of personally driven. So I mean, I grew up in an intergenerational Italian household. So as a child, my grandmother, after my grandfather died, my mother's mother came to live with us. And, we shared a bedroom, and she was just part of everyday life. And, I didn't think about it at the time, but I feel like that was very formative. I mean, it was just a way, it seemed very natural and normal to me I didn't see aging or older folks as this abstract concept, something fearful, something that's just way in the future that doesn't touch my life. It was sort of right there with me. And, my experience was, older folks are full of stories and kindness. And I think it stayed with me. That experience has sort of stayed with me. And I've always just gravitated towards older folks, just again, these incredible lives lived, these incredible experiences and stories, and just to listen to that, I mean, it's amazing. So I think at a personal level, it's something that's come out of my background, my family life, and then by the time I got back to university for the second time, when I was doing my PhD at Waterloo in cognitive neuroscience, the other, I guess, turning point for me was I took an epidemiology of aging course, and it was just fascinating, looking at from the health and population health angle to understand lifespan issues and aging, and that's where I became incredibly interested in cognitive decline and cognitive impairment, cognitive health in seniors, and that pretty much launched me into seeking out opportunities to volunteer with seniors, to volunteer on research projects with seniors at the university, and it just kind of built from there. So I would say those are the two probably pivotal examples or incidents that sort of drive this passion for me.
Yeah, it kind of makes me think of, people sometimes talk about the head and the heart, and you had this heart experience of just honoring older people in your life as a young person growing up, and that sense of integrated living with people of different ages in community, and then your sort of academic side, you were able to bring those two things together. And I'd like to hear a little bit more about what excites you about the kind of work that you're doing. What makes it meaningful to you? Are there any particular stories or events, encounters that really make you say, like, yeah, this is what it's all about. This is why I'm doing what I'm doing?
It's that piece of being able to connect with people, in very deep and meaningful ways. When you go into this kind of work with, I think, with that in mind, with that kind of lens and that kind of open-heartedness, I feel like, you see some incredible things. I mean, there's a lot of learning that's happening, a lot of in terms of research, but then there are these profound experiences about what's possible, where, for example, where, say, with someone with dementia, we can think in terms of physical function or health function and understand, well, they have lost this ability. They if you look at it in terms of this sort of reductive idea of purely, health function or physiological function, their world seems very limited and shrinking, and there's a lot of stigma and fear associated with that. Family members feel like, oh, that person, we're losing them, they don't exist anymore. But I would say, on the contrary, through the work that I've been fortunate enough to be a part of, where you are again prioritizing building relationships, you are looking for what's possible. I remember in one of my earliest experiences with people with dementia, when I was volunteering at Sunnybrook in their art therapy program at the Veterans Center, and we would have these music classes. And I remember there was one man who, I mean, he was in his 90s. He had multiple health issues, but primarily he had suffered a stroke, and so language was not there. He struggled to speak. He struggled to make himself understood and to understand. And he was having, I remember he came into our music class and he was having a very bad day. He was, depressed. He was kind of shut down and withdrawn. And I remember the music therapist handed him like a hand drum and just said, let the music speak through the music. And so we all started drumming together, and he was like, you could just see him change. He was getting into it. He was listening. He was feeling this community around him, supporting him through, participating in this group activity. And by the end of it, he was like a completely different person. He left the room. He was smiling and he was relaxed, and he was just, it was an incredible transformation to witness. And, where if we had just assumed that, well, that's just the dementia or that's just the stroke, and, we can't really do too much, he might have just stayed withdrawn and isolated. But there was an opportunity to bring him out, to include him, to make him feel part of life.
That's so wonderful. And I think there's a tendency that we have to sort of envision folks that are experiencing significant cognitive decline and just sort of think of people as they're sitting in a wheelchair in a room, with a blaring TV on, or they're just kind of gazing off into the distance, or they're wandering around, or and we sort of have this tendency to think, well, what is there left in that kind of a life? But the kind of work that you're doing and describing here is bringing out what still, as you said, like what still is possible. And what we just have to be a bit creative about how to access these creative outlets for people to express who they are and to connect with other people. So that, to me, that's really wonderful, and I'm glad that's sort of the kind of thing that I was hoping you would share with our audience, because I think a lot of us don't have access to that kind of experience or that awareness of what really is possible. So one of the things at the Kernel Network that we're just sort of all very passionate about improving end-of-life care, and so I like to ask people who have a bit of an inside track like yourself, when you think about our care system, and I guess we'll just focus on Ontario because most of your work has been in Ontario, and I live in Ontario, that's where we're both working. But if you consider the way that in Ontario we take care of seniors, and what would be, first of all, one or two of the biggest strengths that you see in the system that currently exists? Because we all know, like in the media, it's really easy to gravitate toward the problems, and there are a lot of problems. But what's one or two things that, from your perspective, we do well?
I mean, I've seen, like integrated health teams, that whole idea, the whole person care that I've witnessed, I think is really a huge strength. And, something on a personal level, like my mother has been living with Alzheimer's disease for the last 15 years. And, going through, we've experienced the highs and lows of the healthcare system in terms of her care, but in terms of the highs, I mean, when she had to go into hospital for a short period of time, the level of care that she received, and the way, dietitians and physio and neurology, the way they all worked together to create a really thorough understanding of her condition, her history, her life, her background. It was really amazing. So I think that these are incredible strengths of our care system, and they work well.
If you were to pinpoint one thing that we most need to improve about the way that we care for older individuals in our society, I know that's a massive question, really, but if you could say there's one thing that I would want to tell people, this is what we should focus on, this is the most important, or like one of the most important or core issues, what would you say?
All of the years of my research, I've never heard anybody say, well, I want to go and live in long-term care, and people want to stay home. They want to be home for as long as possible. So I feel like, looking for ways to make that possible, to empower seniors to be able to have a community of care around them that allows them to stay where they want to be, which is at home, I think is probably, top of mind for me.
And so this connects for me a little bit back to what you were saying earlier about some of the work that you've done in, I think you call them a NORC?
Yes. Yeah, these are naturally occurring retirement communities. And just to clarify, they are not sort of government-funded retirement homes, or these are just, it's a geographic designation. So they're high-rise buildings, or they can be, neighborhoods where there's just a high percentage of older people living there.
So it's not like the government planned for there to be this area for seniors, or an institution put in that place, but it just sort of happened that way. And now how can we support that? How can we support people who are hanging out there?
Yeah, exactly. And so one of the projects the project that I'm currently working with is exploring the option of, like, here is an incredible opportunity, where you have these areas, these buildings where the majority of residents are over 65, and a good percentage of them are over 80. Here's a wonderful opportunity to see what can we do to make this environment, to make this living situation better for them, to create a sense of community, a community of care for them? Or how can they engage, to do that for themselves, right? So it's not just a program that we deliver to them. It's something that we engage them in the conversations. We provide the coaching, the sort of facilitation support for them to create for themselves the kind of place that they want to live, the kind of life they want to live, the kind of community they want to have,
For me, it's almost like a paradigm shift, what you're describing in my mind. When I think, well, we need to, so we don't like the way that long-term care homes are now, so we have to build, new communities or specific villages, or we have to build residences in a new kind of way. And that's just going to take a ton of money and infrastructure to build up that kind of thing. But if you can somehow just say, well, where are people kind of naturally gravitating to, and where are people living, and how can we come around that and just support community to develop and thrive there? I don't think I've really heard people talking about that much before I had talked to you about it. So is this something that people are doing quite a bit beyond, the folks that you work with, or is this a strategy that people are adopting?
Yeah, this sort of NORC movement, it started in New York City a few years ago, a while now ago. So it is something that is happening. It's happening, throughout North America, and certainly even in Ontario, there is a group out of Kingston that started this kind of concept called the Oasis program, where they were. It was senior led by an incredible groundbreaker, like pioneer, Christine McMillan, who organized in her building, started to connect with residents in her building, and connected with community partners and agencies to get services brought into the building. So there's like many ways in which this can play out. So we at OpenLab, we are starting sort of with what can the residents do for themselves, sort of working with what currently exists, and then from there looking at who else, where there are needs in that community or in that building that the seniors can't provide a solution for just on their own. How can we connect them? How can we draw on our network of connections in terms of service providers and community partners to work with them, to connect them to those people, to bring them in, to create more of a supportive community for them. So it's something that can grow, but it's definitely, it's, I think, new-ish, but it's definitely something that has happened. There are models out there that we are drawing on.
Seems like a really smart approach and a really smart angle to try to take, just as we try to support our aging population and find good ways to do that. The last question that I had to ask you is just, I guess, a bit more broad, but maybe it's going to dovetail from some of these questions that we've already been talking about. But I'm just wondering about your vision. I like to try to think about the challenges that we face as a society, but in light of those challenges, I think we need a vision to be able to see where we can go and what does it look like to make things better and to improve things. So if you were to say sort of like, I don't know, you don't want to go too idealistic, but like what would be like one or two of the main ingredients of a vision that you'd like to see realized for communities in Ontario, and a little bit about what would that vision be, and if you had other people like students or interested members of the community or public, other healthcare professionals who might be seeing this, who share that kind of a vision, how might people get involved, or how might we kind of move toward something like that?
I guess it's a vision really of culture change, right? Like what we're talking about here is changing the culture of care for seniors, health for seniors in the community. And I guess for me, like the secret sauce is that that relational piece, that sort of putting the relationship building piece at the center of it, because really that's the thing that drives it, right? That interest in getting to know your neighbors, getting to understand what is life like for them. What are what are the things that bring joy? What are the things that are the biggest barriers to living fully and meaningfully? And I think, that kind of consideration is something that can be woven in, whether you are, doing something at a grassroots level, like what we're doing with the NORC Ambassadors Program, working with residents, where residents are sort of doing it for themselves kind of thing. I think we're very action oriented, and certainly action and task is really important, and there's a place for it. But before you can act, you listen and to understand. Make sure that you are engaging with all, inviting everybody to the table, I guess, in terms of having those conversations.
To me, this is like such an important piece, because I feel like in our society, there's a real tendency for people to gravitate toward sort of like, I'm at home, I've got my computer up, I've got Netflix on, I like to watch this, like I do my work, and then I come home and I just kind of go into my own little nice comfortable bubble. And thinking of people really getting out and opening up to relationships with their neighbors. I mean, I've lived on a few different streets in my life, and I would say most of my relationships with my neighbors are quite superficial, even though we often would have conversations with each other kind of as I'm passing by, but to really, build these relationships at a grassroots level, to me, it just feels like something that's massively needed and yet very difficult. And I'm not really sure, like, how do we move in that direction,
I've had the experience of, talking about this kind of relational care approach with healthcare workers, and sometimes it feels like one more task that they have to do in a day where they're really consumed with doing so much and just incredibly busy days to help with patients. But sometimes I think it doesn't have to be one more big thing that you have to do. I saw it with my mom when she was in hospital, where it was just the difference of, and she was having some mood issues, some what they call behavior issues. She was frustrated because of what was happening to her and sort of acting out. And, she might have been perceived as being hard to deal with from a healthcare perspective. But I remember watching one nurse, and she was amazing with her. And all she did was thank her, sort of ask her permission. So, can I brush your hair now? Thank you. And it was just asking permission and saying thank you. And I just saw this incredible, I could hear it, this incredible transformation in my mom. She suddenly became receptive and, just grateful and sort of connected to that person. And it just, therefore the evening sort of care routine, it just went so smoothly. And it was a huge eye opener for me to see that even for myself as a, family caregiver for my mom, there's those moments of frustration, and you're kind of like, feels like a battle will sometimes, but just watching her model that for me was really powerful and made me see that those moments of relationship can be really small, simple things, but very powerful. So
no, that's really great. And I mean, I think in some ways it brings together this whole conversation for me, where we're talking about integrating the heart and the intellect, and what you're doing in terms of your work, but also with your community and just relationships with neighbors. I feel like okay, what was I going to say about this? It was basically, I kind of lost my train of thought right now. But what I really like is this. It sounds to me like, in a sense, we're talking about being a human being, like being open to others in relationship. And the way that I understand being human is a very relational sort of thing, and just being able to be open to the way that your life intersects and interconnects with other people's lives, but living with a bit of an openness toward others that we're sometimes. But I do think you're right in identifying that sense of busyness. For me, that's what it comes down to, is oftentimes I see an opportunity for a bit of a brief conversation or discussion, but I know I'm on my way and I'm already late for something else, and I'm trying to kind of rush past and get somewhere else, but if we could make more space in our lives for those kind of things.
And it's really hard. It's a hard thing to practice. I remember at the Beethoven Academy, I was working with one fellow who, just the loveliest man, but I was having a bad day and he was having a very bad day. And so we were trying to work on this art project together, and it wasn't going well, and the conversation wasn't going well. And, a colleague I was working with just said, just take a minute, go take care of yourself, come back and start again. And so I took a pause, I left, got a drink of water, came back, sat down with him, and just sort of explained, let him in on what was happening. And I'm sorry, I feel I'm dealing with blah, blah, blah. And it opened up the conversation. We could, he opened up to me, he understood, we talked about a whole bunch of, he told me a bunch of stories that were related, we connected, and we just kind of got on with things. And so it was really, a big learning experience for me, and it's not something I can do successfully. Even now, it's a practice, and it's really hard to do, to be with, right? To pause, to be with people in that full way. But I think it's worthwhile, especially when you are in kind of environments of care, whatever, not necessarily medical care, but just any kind of environment of care.
Yeah, it's so good to hear this from you, and to think of you as a person who has done many things and has been very action oriented yourself, and accomplished a lot of things and been involved in a lot of work, but sort of saying, what it boils down to in the end is just something about something that everyone can do. It's about being human, but it's not. That doesn't make it easy to do, and it's something that we somehow have to learn and practice, and be willing to, I guess, make mistakes. But Lisa, I just want to say that this has been a really incredible conversation, as it's always been a great pleasure talking with you, and thank you so much for being willing to share these insights with people, and look forward to anything that might come out. If this book ever does emerge, or you put together an art exhibit or something like that has some commentary, that'd be really wonderful. But otherwise, just excited about continuing to be able to work with you. And anything else you'd like to share before we wrap up?
No, I just want to thank you so much for giving me the opportunity to share some of these experiences, and for being such a great listener, and just to have this opportunity. Thank you so much. It's been a really delightful conversation. I really have enjoyed thinking about these things with you and talking them through. It's always inspiring. So thank you.